to the sneak preview of my presentation at the Jahreskongress der Deutschen Gesellschaft für Geriatrie. I'm Nathalie Velde, a professor in geriatrics at the Amsterdam University in the Netherlands, and specifically working on falls prevention. I'll be presenting on the 1st of September in the morning and specifically be discussing medication-related falls, as this is a very important reason for falls in older persons. In fact, if you turn it around, falls should be seen as an important adverse drug reaction and approached as such. And we also see that in the guidelines, both nationally and internationally, withdrawal of fall risk increasing drugs is advised as part of the multifactorial falls prevention measures. However, in clinical practice, we find this difficult to do. For this reason, I will take you through the current evidence that there is. I will be talking about which drugs should be considered fall risk increasing, but also how and when and in whom to deprescribe. And specifically, I'll be talking about a new European tool, Stop Falls, that will help you to deprescribe. And it has recently been published in Age and Aging. So I hope to see you all there, and thank you for listening.